This guide will show you the steps to set up and use IntelligEYES correctly. IntelligEYES is made up of two components, the headset and laptop. They are connected via two USB cables, which are part of the headset. You must connect these cables to the two USB ports on the right side of the laptop for the system to operate. You may also optionally connect a wired internet connection and power using the ports on the back of the laptop. If you plan to use IntelligEYES without a power cord, plug it in when not in use to recharge the battery. After connecting the headset to the laptop, press the power button above the keyboard to turn on the laptop. If you did not plug in a wired internet connection, you must connect to a wireless network. Click the Wi-Fi icon in the lower right corner of the screen, and then click Connect next to the wireless network you want to join. Enter the password for that network and allow the connection to be established. The login screen will appear when the system establishes an internet connection. Enter the username and password that were provided to you. Then, enter the last name, first name, and date of birth of the patient you will scan. If this is the patient's first scan, be careful to enter all information correctly, as this information will be used to find this patient in the future. If the patient has been scanned before, click Scan. If this is a new patient, click Add Patient. For new patients, select the patient's gender and answer the questions about potential risk factors. If the patient has any relevant information that is not collected by the form, enter it in the Notes field. Verify that the patient has signed the consent and release form. Store this form as part of the patient's record. Click the Scan button to save the patient's information and go to the scanning screen. Have the patient sit in a comfortable chair. Remove his eyeglasses, if any, and place a sanitary cap over his hair. Ask the patient to open his eyes wide and place the headset on his head. On the laptop, you will see video from the headset. Ensure that the patient's eyes are centered vertically in the windows. If they are not, you can adjust their positions using the dial on top of the headset. To raise the pupils, turn the dial counterclockwise. To lower the pupils, turn the dial clockwise. Once the eyes are positioned correctly, push the knob at the back of the headset and turn it clockwise to fix the headset in place. Ask the patient to look at the blue light displayed in the headset. If he sees more than one light, ask him to focus on one of them. Click the Run Test button to trigger the scan. The video of the patient's eyes will be replaced by a recording message and the scan will begin. During the test, remind the patient to focus on the light, keep his eyes opened wide, and avoid blinking as much as possible. When the scan completes, the light in the headset will turn off. Loosen the headset by pushing on the knob at the back and turning it counterclockwise. Then, remove the headset by lifting it off the patient's head. The information collected will be uploaded after the scan completes. This may take several minutes, depending on the speed of your internet connection. If you plan to scan another patient, click the Change Patient button to enter her information. If you are not planning to scan additional patients, wait until the upload has completed and then turn off the laptop by clicking the power icon in the lower left corner of the screen. Select Shutdown to end your session. If you have any questions about using IntelligEYES, contact Axon Medical Support.